Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what is for the angle closure glaucoma, what is the treatment? That if you were asked what is the definitive treatment, of choice, so the definitive treatment of choice is actually a surgery, which is laser iridotomy is done in the angle closure glaucoma. This laser iridotomy is done using an Nd:YAG laser. So here this is a laser. So with the help of this laser, we will remove this iris, or not we will not remove, we will dissect it. We will make a hole in the iris so that the aqueous humor can directly drain into the trabecular meshwork from the posterior chamber into the anterior chamber and trabecular meshwork easily, rather than it normally, if there is no iridotomy, it should pass like this and it should go, but here angle is closed, so it is difficult. So as a result, if you do it, you are introducing a shortcut for the drainage of the aqueous humor. So before you do these surgical procedures, first and foremost, we should control the intraocular procedures. So before surgery or any surgical procedure, we should control the raised intraocular pressure. So for controlling raised intraocular pressure, we can use either IV mannitol or IV acetazolamide is used for this purpose. And once the intraocular pressure is decreased, that is when you can use either a laser procedure or surgical procedure can be used for the treatment of angle closure glaucoma.
thank you and thank you for watching.